Hello. So I'm Dr. Orlando Landrum. I'm here to talk to you about degenerative disc disease and stem cell therapy. So one of the things that we're going to talk about today is spinous processes. And in the course of talking about that, we're going to get into the nature of disc bulges, exactly what that means, and how that works. So as we kind of explain that element, one of the things that we really want to be able to get into is understanding the difference between a normal disc, a degenerative disc, a bulging disc, and a herniated disc. And so when we talk about degenerative disc disease, it's different than a bulging disc, it's different than a herniated disc, and it's different than the aspect of a disc extrusion or herniation. So as we get into this, really the thing that we're looking at is the context of a normal disc versus a degenerative disc. And so when we talk about normal disc versus degenerative disc, one of the things that we see is the following. For a normal disc, what we see is it normally has no narrowing, no cracks, no fissures, nothing of the sort. When we talk about the aspect of a degenerative disc, it certainly does. So for instance, when we take a look at this picture, one of the things that we see is the context of a disc that shows a normal disc on the left and a degenerative disc on the right. And that degenerative disc on the right shows you that narrowing, that loss of fluid, all of those things that are in place. So what does a traditional disc anatomy look like? So what traditional disc anatomy looks like is the following. So what you'll see is the disc has a center, which is called the nucleus pulposus, and rings, which have these layers like tree rings. And so when you see those tree ring layers, they form a harder part of the disc, which actually provide a degree of support that's present within the context of the spine. So when we take a look at those aspects of these tree rings, one of the things we really need to have an understanding about is how does that exist within the context of the spine? So for a quick frame of reference, let me show you a picture that gives insight about that central nucleus pulposus and then those rings, which is the annulus fibrosus. So if you're looking at this and you look above, you have something that's called a vertebral end plate. And those vertebral end plates show where the bones are and where the disc exists. So for one quick second, let me show you what exactly I mean when I say that. So what I mean when I say that is the following. One second. So if you're to take a look at the spine, what you could easily be able to see is the aspect of a disc, bone above, bone below, and the disc existing in here. What we're looking at is the aspect of degenerative disc disease, which basically means, do we have a problem here versus us having a problem like a disc bulge? This is not what we're talking about. More so, we're talking about the disc itself. So When we go back to that picture and we take a look at this, what we see is you have these bones that sit above, below, the disc in between, with the central area that shows that disc having the components of a soft center and then a much harder side. So when we get into further assessment of that anatomy, what we see is that disc from both looking top down as well as from the side. So one of the things that we're able to deduce and figure out is that element of the components of being able to see that nucleus pulposus in the center, and then those ring-like structures around it, which is the annulus. And then you can see in the front, which would be the anterior longitudinal ligament and the posterior longitudinal ligament in the back. Or if you're taking a look at this picture from the side, the same type of thing that exists. So with all that, we have a grounding in what basic anatomy is, right? We have an understanding that when we take a look, what we really want to be able to understand is how does that disc cause problems that result in pain and dysfunction. So how it can cause problems and result in pain and function is that disc starts to narrow. And we really start wondering, okay, when the disc narrows, big deal. Who cares? Well, the reason why we care is that disc is hugely important, is integral to the structure and the functioning of how well our spine will be able to do the things like it that it needs to do, whether it's load bearing, whether it's mobility, all of those type of things. So when we look at the context of a spine and we look at the elements of that disc, it's hugely important. So when you're deciding to bend, when you're deciding to twist, if that disc is not properly oriented, what you'll start to see is changes that take place within the context of the holes where the nerves exit out from, where the balance of the areas of the aspect of the facets and the joints that are in place, and the overall structure and alignment of the body and the spine. So when the discs start to decrease in size and measure, we have the same type of problems that we really worry about with things that would lead to potentially the need for surgery. And that's what we're looking to be able to avoid. So historically, it's been physical therapy, epidural steroid injections, exercise, and then this huge jump, and then we're talking about spine surgery and fusion. Well, one of the things that really has kind of come to the fore has been the following. And so someone mentioned the aspect of limited range of motion. And that's correct. You can have limited range of motion as the discs start to decrease in size and other things that can kind of take place. But one of the things that we've really been looking for is how can we be able to ameliorate this in a different fashion? And one of the things that has really been touted for a number of years has been the aspect of regenerative medicine, and specifically stem cell therapy. Many people that don't do regenerative medicine and stem cell therapy have said, you know what, that's hogwash. And that's a nice way of saying it because they're really picking most of the time words that are much worse than that. All right. But what we're going to talk about today is a really extensive, hard look at a meta-analysis where we take an overview and then we drill down into what exactly are each of these different papers looking at, what did they find, and was it valid, and did it have statistical significance? Okay, in 1 second, we're going to be back to talk about this in depth and detail after a quick session that talks about what we do, how we do it, and how we hope to be able to help you. So what we're going to do is take a look at a paper that a colleague, a friend, and a mentor mentioned to me, who's a phenomenal regenerative medicine doc. His name is Christopher Williams in Atlanta, who actually really said, you know what, you need to look at this paper, you need to analyze it, you need to assess it, you need to evaluate it, and really bring it to not only physician colleagues, but also to patients. And so one of the things that I think about is that many times docs, not to knock us and not to try to get on patients' good side, we don't take the time to take patients and walk them through research studies so they can be able to say, how can I evaluate this and see, is it a fit for me? Is there understanding about how this makes sense or it doesn't make sense? So what we're going to do is take a look at a paper that is the following. It's a systemic review of is intradiscal injection of bone marrow concentrate for lumbar disc degeneration effective. So first of all, just looking at the title, it looks intimidating. But as my patients know, one of the things that we're here to do is to make that intimidating piece not intimidating at all. So if it looks like a mountain, we're going to make it a molehill. Instead of us feeling like we can't climb it, we're going to figure out how to be able to step over it. Okay. So let me kind of go through this title again and explain to you exactly what I mean when we describe this. So a systematic review, it means that this paper was analyzed and evaluated by the authors in place, and they were really looking to try to be able to break it down. Does this make sense? It's coming from an orthopedic and sports medicine background, which traditionally will look at mainly surgery, and they really wanted to kind of give a good analysis. Does this type of treatment make sense? So intradiscal. What exactly is intradiscal? And I'm pretty sure that there are many people who are viewing this currently that understand exactly what intradiscal is. But for people who may be viewing this at a later point in time, in essence, what it's talking about is if my pen was a needle, is that basically we're going within the context of that disc. We're going to be able to see and place bone marrow, stem cells in essence, that come from bone marrow there and see if it improves specifically pain and also function. Those are the things that we're assessing. So in this context, we're looking specifically at disc degeneration for the lumbar spine. So disc degeneration being that narrowing of the disc, not disc bulges, not other things that are going on, but really things that deteriorate and cause problems with the disc so we can assess it, evaluate, and understand it. So when we go into this particular bigger, broader view of this paper, one of the things that they look at is the following. And so they did a review and they give you a breakdown of what's the review. So they did a meta-analysis. They looked at a whole host of different levels of studies. And really what they were looking for was the outcomes of intradiscal bone marrow concentrate injections for lumbar disc degeneration, and it was all among adult human patients. There weren't any animal studies. There weren't anything that were looking at in vitro, meaning outside of the body. These were traditional patients that were being treated. So when we get into the further context of this, the breakdown is they looked at a whole host of things that were key, but the end of the day, they found 7 articles that really looked at a total of somewhere around 97 subjects that had had intradiscal injections, with a breakdown of 47 males, 38 females, and an age range that was anywhere from a mean age of 33.9 to plus or minus 14 years. And what they looked at was all subjects that had had injections into the nucleus pulsus of one or more of affected discs. Okay. Additionally, this study was really looking to see, was there some degree of statistical significance? So let me kind of repeat that again. Statistical significance. That's how we determine whether a paper makes a difference or not. Statistical significance means, yeah, it might be somewhat of a difference, but does the difference really hold true when we look at this and extrapolate it across a number of different populations? And that's what this meta-analysis was doing. It was looking at each study, saying, does this make a difference? Does this make a difference? Does this make a difference? And that's really what we were looking to ascertain. And what they also wanted to know was there any complications? And did you have to re-inject the person multiple different times? All of those things were involved and evaluated. And when we get down to it, what they did is they saw studies both internationally as well as here from the States. So there were 3 studies that were from the United States, 2 studies that were performed in Japan and Spain, And so they assessed also what was the breakdown of the injection. But for the most part, almost all the studies had a bone marrow aspiration, meaning a draw, that was anywhere from 30 to 90 mLs that were all autologous, meaning the cells were drawn from that person. They were withdrawn from that person and re-injected into that person. Nothing that was extraneous, okay? And then it was traditionally an injection into the disc of 2 to 3 mLs of bone marrow concentrate into the area. So, as people know from Cutting Edge Integrative Pain Relief and our YouTube channel and Facebook, what we look to do is to explain it, break it down, and have people understand exactly what we're talking about so you can reference it and see it for yourself. So this is what's present in the chart that talks about the different studies that are kind of like in columns, but no one really can see that unless you're really up on top of it, right? So these are the different studies that are actually the breakdown. And we're going to walk through each one of these as that original study did and talk about what was unique about each of those studies. However, before we get into that, we're going to give you a summary. So in essence, I'm going to tell you, what did they find? What was the conclusion? So that way you get sort of like that appetizer. Before we talk about serving you each of these 7 different courses, I want to cut to the chase and give you the dessert ahead of time. So that way you know, but just don't leave because you really want to eat each one of these courses, all right? So what they ended up doing is they took a look at VAS and ODI. So VAS is basically a pain scale and ODI is a function scale. So if you look at the bottom of this chart, it says visual analog scale and ODI is Oswestry Disability Index. And what they looked at was there differences at 3 months, at 6 months, at 12 months, and 24 months? And those little asterisks that you can kind of make out on the side basically shows there was a difference at each one of those for not only for pain, but also for function, meaning there was constant improvement after intradiscal injections using bone marrow concentrate to not only improve pain, but also to be able to improve function. So there's a question that was posed very astutely from Elaine, who's a nurse that is a phenomenal nurse, pain nurse that is from Chicago, that asked, where are the stem cells taken from? So let me go back because I know I kind of ran through that pretty quickly. Let me show you what I was talking about earlier that I maybe kind of popped through too quickly in the context. And I believe it was present. Let's see. Here we go. So if you can follow the cursor, what it shows is from the third line, BMC was obtained by centrifugation of 30 to 90 mLs of autologous 6 studies bone marrow aspiration from the iliac crest or posterior superior iliac spine. So for those of you who are like, what? Let's give you clarity about what does that mean. So if we're taking a look at our spine model here, right, doing the best kind of Vanna White with an anatomical spiel, what we're talking about doing is being able to acquire it from this element. So if you're taking a look, this is our spinous process, kind of appropriate for a skeleton near and around the aspect of October. You spin this guy around, and what we're looking to be able to do is to be able to acquire cells from here. Sometimes it's acquired from here. So both of these two areas to answer that question, okay? So as I was saying, one of the things that they found is that there was a significant difference in the context of improvement in both pain as well as function, and it wasn't short-lived. It wasn't just for the aspect of 3 months. It wasn't just the aspect of 6 months. It wasn't the aspect of 12 months, but for 2 years at the very least, and some studies longer than that. So if you read this, the baseline pain was somewhere around a 6 out of 10. And they were able to take this, depending on the time frame that it was sampled, to a 2 or sometimes 1.7, 1.9. And that's really what we were looking at when we were assessing this. So what else did they find? Well, the thing that they find on that original top-down view was, and this, I'm going to read it verbatim, which normally I don't do, is despite our skepticism regarding the efficacy of the procedure, intradiscal injection of bone marrow concentrate for lumbar disc degeneration resulted in a statistically significant improvement in both VAS and ODI, remember those are pain scores and functionality scores, with low reinjection and complication rates in the studies assessed. Now, they did make a commentary about the level of evidence, which is a level 4 evidence, and preferably we want level 1 evidence to really be able to assess it. That's how critical the studies are in randomized controlled trials. But those things still show that there's statistical significant evidence that was present. So, how can we get down to the root of the matter? Well, we're going to get down to it by going paper by paper and talking about a quick synopsis of what it is that we found, right? So a paper by paper studying is the following, is as we take a look at each of these different ones, we're going to give you the title. So you can Google it, you can save it, you can write it down, or if you're watching this at YouTube, you can be able to reference those papers and go back and take a look for yourself. So paper number 1 that they evaluated was the following. It was an intravertebral disc repair with activated nucleus pulposus cell transportation, a 3-year prospective clinical study of its safety. It was done in Japan at the time, and what they did is they did the things that we talked about before. What they specifically referenced is the following as one of their figures in their paper, is they looked at disc, and particularly in relationship to those things that had a fusion. So you have surgical hardware that were in place, and then not dealing with that level, but above it. So adjacent disc with moderate degeneration or normal disc. What they looked to do was to be able to take those cells from the bone marrow, put them in culture, and then following that, be able to inject into the nucleus pulposus and see what type of response they were able to get. So when we take a look at that, let's just look at their figure that they have from it. So if you take a look at this imagery, what you see on the left is the pre, what you see on the right is the post, okay? So in the center, you can see the hardware from an X-ray type picture, and you can see that you have both rods and screws that are in place. You can see the needle that's coming into the aspect of the disc. This is between the L3 and L4 processes. If you take a look at the pre on the left-hand side, you can see that disc. And that disc we're going to talk about a little bit differently, but you can see that it doesn't have the same type of white coloration. It's a little bit decreased in height. And when we come back and we take a look again, over here on the right-hand side, L3 and L4 was the level that we treated. We compare it left to right. You can see that there's an improved water content. There's an improved difference that's present within the context of the height, and that they found there's statistical significance between those two elements of having injected bone marrow concentrate. So that's paper number 1, okay? But you got one paper, big deal, all right? It was done in Japan. Maybe that's not going to necessarily be all that applicable. Let's take a look at paper number 2. All right, so paper number 2, intervertebral disc repair by autologous mesenchymal bone marrow cells, a pilot study. So this study was actually written up and put forth in Transplantation in 2011. And what they did is they really looked at, what makes sense and how do you compare this to some other treatment options that are out there, particularly not just bone marrow stem cell injection, right? So what they looked at was the degree of improvement in pain or function, and they plotted it. Now, this is a little bit graphical, and I know it's pretty colorful, but also maybe a little bit intimidating. But follow along with me for 1 second as I kind of explain this, all right? What you're looking at when I pop that graph back up is you're looking at that x-axis and you're looking at that y-axis, and they did a slope of improvement in function. And the further up your slope is, the better you have in terms of pain and function. And one of the things that they assessed was exercise, which kind of ranked in sort of a lower, lesser slope. And then they compared it to the aspect of fusion and surgery. And I know that most people don't want surgery and fusion, but understand they're using this as what historically most people have used as a gold standard. And then they compared injection comparatively to it. So one of the things that they did is the following. So if you take a look at the colors, you can see a perfect treatment, which is 1.0 in blue, right? Now, we'd love to have a perfect treatment, but nothing like that really exists just yet, right? And then they took a look at exercise alone, which can be useful. Don't mistake that I'm saying, oh, exercise never works. It can work, but what we're talking about is in the context of degenerative disc in particular, right? And then they looked and they compared it with a whole host of different interactions, right? They looked at traditional fusion, and then they looked at fusion that's augmented with a certain type of cellular function, and they compared it with this study. And this study, if you can see that in kind of that light purple, was that intradiscal injection, meaning better than traditional fusion, not quite as good as fusion plus some cellular therapies combined together. But the upside is this: you don't have to get your back cut open. You don't have to get screws and hardware put in place. That's a huge uptick, right? I mean, so when they got down to it and they looked at their summary, this is what they said. So when we say the analgesic effect of treatment with MSC and mesenchymal stem cells was remarkable, it was approaching efficacy. There was improvement in pain as well as in disability and improvement in life quality. They've been able to compare the results with outcomes of other clinical trials, and what they have been able to find is that they have been able to achieve improvement in pain of 85%, and it was attained at 3 months. And what they were able to do is to figure out how that compared to surgical interventions. So pretty interesting. Most people would say, well, 3 months, I don't know if that's going to be good because I only have relief for the aspect of that amount of time frame. But we're going to talk about studies that have looked at much longer time frames. So paper number 3. Disc regeneration therapy using marrow mesenchymal cell transplantation, a report of 2 case studies. So this one isn't as extensive, but basically the summary is the following. They did autologous mesenchymal stem cells, and what they did is they did degenerated intervertebral discs, and they injected into 2 patients, and they followed them for 2 years. And what they were able to see is that symptoms were improved, and that the intervertebral disc regeneration from stem cells brought about favorable results. Now, this one is much more so a lower powered study. It doesn't have as much validity. You say you treat 2 patients, how is that going to necessarily be applicable to me? Well, that meta-analysis took into account that study's okay, but it's not as good as what we really want. That's why we augmented it by looking at other studies to see how easily is this able to be identified as value for people. So let's take a look at paper number 4. So paper number 4 is autologous bone marrow concentrate, intradiscal injection for the treatment of degenerative disc disease with 3-year follow-up. 3-year follow-up. So when we take a look at that, what they were able to see is that they were able to see improvement in overall disc degeneration, and it not only took place in year 1, but it was able to be seen across the aspect of 3 years. And one of the things what they did was, and this is kind of like a quick reference so you understand, is they took a look at the degree of disc degeneration. So this is not from the paper, but when you take a look at disc degeneration, at its worst, it looks something like this in the bottom right-hand corner, where you can kind of see this narrowing, this loss of water. There's nothing that's present. Versus at its best, you have this robust spacing that's in place. You have a concentrated nucleus pulposus with the aspect of that water content that's in place. So that paper was able to show that after 3 years, you're able to see value. Paper number 5, done here in the States, in Colorado. So treatment of lumbar degenerative disc disease, associated radicular pain with culture expanded autologous mesenchymal stem cells, a pilot study on safety and efficacy. Pardon me on saying it's Colorado because it's culture expanded. We come back to that on a different day, but it was done by a number of different doctors, including Dr. Centeno, Dr. Markle, Dr. Dotson, Dr. Stemper, Dr. Williams, who I mentioned earlier, Dr. Heisey, Dr. Freeman, and Dr. Itch. All right, so it was actually published in Journal of Translational Medicine. That was 3 years or so ago in 2017. They looked at a number of different things, but to kind of get down to brass tacks, these are some of the things that they really looked at. And that is being able to assess what was the treatment of lumbar disc disease associated with radicular pain and how that compared over a time frame, which is extensive. And so if you look at the dark coloration, that basically says better. The light coloration of the gray is no change. And what they did is they looked at 1 month, 3 months, 6 months, 12 months, and then they went out a number of years, 3 years, 4 years, 5 years, 6 years. And what you can be able to see is as that kind of evaluated that concentration, the difference in terms of pain and percentage of patients that got improvement sat somewhere at the very worst about 70%. And that lasted for as long as 6 years. It's very seldom that you get many studies that will look at a 6 year outcome and response, but let's delve into this even a little bit more. So then they provided actual results of patients that they treated. So when you take a look, they can be one of the things that you can see is that aspect of traditional disc. And in this context, they didn't look at just disc alone. They also looked at it within the context of disc bulge. So if you look at the bottom of this, they wanted to see if there was improvement of disc bulge. So on the left-hand side, you can be able to see where it started in terms of the top component. And then on the right-hand side or at the bottom, you can be able to see the degree of improvement. So A is that aspect of pre-treatment. B is that aspect of 5 months post and what was able to be shown. So one of the things that you can be able to see is that as actual changes in disc bulge following the treatment. That wasn't the real intent. It was to try to see if there was going to be improvement in disc degeneration. But not only did it get that, but it also got improvement of bulge. So on the left-hand side is a sagittal view. On the right-hand side is a coronal view. As you can see, that bulge and pressure that's on the aspect of the spinal cord was able to show improvement. So what was the summary for that paper? What they basically said is the following: is given the many things that can cause that degenerative disc disease and multiple structures involved, what they think is that the treatment with stem cell may be able to delay, arrest, and possibly reverse the cascade of degenerative disc disease. And that this effect can be stabilizing and it can reverse the changes that are seen in the annulus fibrosus. Again, if you recall, that annulus fibrosis is the area that had that lamella or that aspect of the rings like trees that showed problems and differences that was a breakdown. So what they said is that those areas that can be able to potentially be changed, and that area of the annulus fibrosis is comprised of fibroblasts that create different structures, type 1, type 2 collagen, proteoglycans, elastin, and other proteins. And those mixtures may be able to be improved with stem cell therapy. So paper number 6 is the aspect of intradiscal injection of autologous hypoxic cultured bone marrow stem cells. So that component was evaluated in 5 patients with chronic low back pain, and it was really assessed as to the feasibility. And so one of the things that was in summary from this, and this is a mixture of a number of different multi-centers that were in place, is they took 5 different patients. They were able to get the cells that, as we talked about before, from the aspect of the iliac crest, and then they followed patients for 4 to 6 years. And what they were able to do was to see the following: is if you take a look, and this is a little smaller, so it may not be able to be viewed quite as well, is the changes in disc height, as well as improvement overall with how back pain as well as function was in place. So one of the things that they were able to conclude was the following: is what they assert is that there is an unmet need prior to surgical intervention for back pain that's associated with degenerative disc disease. And what they are able to state is that degenerative disc disease often leads over time to aggravation of symptoms not only at the affected disc level, but at other adjacent intervertebral levels. And I would say that's a key point. So when we talk about disc bulges and people think about sciatica and the nerve being compressed, or facet disease and you having arthritis in your back that's worse in the morning and worse when storms come in or cold weather, we're concerned sometimes about that focal area. But when we talk about degenerative disc disease, it's not just about that spot, but about the adjacent spots above and below and other areas that affect the spine as a whole. And if we can improve that, we may be able to mitigate overall spine health and dysfunction and try to be able to keep that person not only functioning the way they are right now, but maybe functioning better based off of improving the spine as a whole. So going back to one of the things that they were really saying is after exhausting non-invasive options, patient faced the prospect of surgery, and in particular, lumbar spinal fusion that does not always guarantee complete pain alleviation and can present with significant complications and morbidity. Am I sit here and telling people who are watching this video that doing an intradiscal injection of stem cell is always the right thing? No. Let's be frank. There's not always a right thing for anything in medicine. Number one, we need to know what's going on with you. Do you have multiple different problems? Maybe it's not just degenerative disc disease. Most importantly, maybe it's something else other than degenerative disc disease. And we shouldn't be using this therapy or this option. We should be doing something else, something that's different. But if it is, perhaps we need to consider this as another option in our armamentarium of treatment that most of the time is not mentioned. Most of the time it's kind of glossed over. It's like, okay, you get steroid injections or you get surgery. In this context, what we want to be able to do is to help you punch pain in the face, get your life back, and say, you know what? Let's try something that's different and unique. And if I have to go to surgery, then yeah, we go to surgery. There was a question that was posed earlier, and it was phrased in a very particular way, which is the following. So, how soon would a patient with same set issues be able to undergo this procedure? Asking for a friend, right? Well, quite frankly, there are docs who are doing it right now, and I'm one of those docs. But I'm not here to give you a sales pitch. More so, what I'm here to do is to give you information so that then you can go back at your leisure and research it, or with the conjunction of your doc or other healthcare provider, and evaluate and say, do I really feel like this holds water? Is this something that really has statistical significance? Can it really be shown that this is going to be valuable for me or for someone that I love? That's really what we want to be able to do, is to make sure that you understand it. And that way you can then break it apart and have an understanding about how it's going to be impactful to you. So our last paper is the following: intervertebral disc repair by allogenic mesenchymal bone marrow cells, a randomized control trial. So this is where we really get after it, right? And we can go after the whole detail and depth and all this kind of stuff. But basically, I'm going to show you the figure of what they were able to see. And why I'm saying this is the real deal is a randomized controlled trial is very difficult to do, particularly when you're talking about a procedural type treatment option of this nature. It'd be like saying, okay, well, we're going to see if knee surgery works, and we're going to bring some people in and we're going to actually do the knee surgery, and the other people, what we're going to do is we're going to make an incision and we're going to root around in there, but we're not going to really do the surgery, and we're going to see which one really works. You can do it pretty easily for medication because there's not a lot of involvement. When we talk about doing injection type therapies and aspiration type therapies, sometimes that gets to be complicated, so it's difficult to get randomized controlled trials. But for this holds that same level of power when you look at a randomized controlled trial. And what was able to be found is the following. So when you look at this, it looks a little complicated at first, but the fact of the matter is what we're looking at is the control, meaning that aspect that was not the actual treated area are the open circles, meaning they're black with a white center, right, and triangles. And then the ones that were treated were red in nature. So I know it's disparate and it's spread out. But if you take the summary and you do the slope that's present here, perfect treatment being blue, red treatment being present here as this line with the actual treatment area, and the control being the black line, what they're able to find is a statistical significance. And although it's not perfect, it's certainly better than a traditional placebo type effect, so that you can get improvement with the aspect of stem cell therapy, right? That's really what we're looking at. So one of the things that is being stated is most people don't understand that there's some degree of research that's out there that really are there other options, and that it's either what most docs pose, or some docs pose rather, let me correct that, of saying it's always the elements of either surgery or it's traditional steroid injections or something along those lines. I don't know. I think at the end of the day, the reason why we do these talks, the reason why we try to present information to people that are in a dire strait, that are in pain, is because we think it's needed. We think that it's valuable for individuals to have understanding other options that are out there and not just reaching for Hail Marys, but really being able to say, how critical is this? How well have we evaluated this? How have we really been able to see, is this just a flash in the pan and it's not universal? Or is there really some value to this? And to then be able to take that back to their local docs and talk to them and say, you know what? What about this as an option? And have them review it. I'm not asking for people to say, let's just roll over and do this for everyone, because it's not a fit for everyone. But what I do think is it should be on the table. It should be a conversation to say, what else can we put into play that not only doesn't put people at risk in terms of having to have major surgical intervention, but more importantly, can we be able to improve that underlying baseline condition with less invasiveness? And in this context, I believe that there's value, that intradiscal stem cell can be able to help certain people with degenerative disc disease and some other conditions as well. So I thank you for joining us and being open to hearing some other alternatives. And hopefully, you will consider coming back and seeing some of the other things that we talk about going forward in the future. If you want to know more about how to be able to connect with us, by all means, please join our newsletter and we'll give you insight about how to be able to get further insight on videos like this or other actual brochures and handouts and such by going to cuttingedgepain.com/newsletter. And then if you're interested to be able to kind of find this video going forward, as you can go to our YouTube channel at Cutting Edge Pain Relief that can be able to provide value and give you insight. Um, and so one of the things that we want to make sure, as someone is saying, is being able to break down medical terminology. I know that for many people who are not from a medical background can be daunting at times to feel like, well, I'm not so sure that I can get into a research paper because I don't understand all the words. If you have papers that you want us to evaluate in the context of regenerative medicine, interventional pain, endoscopic spine, send it to us. Add them to our YouTube channel, to this video in the comments. Let us know. We'll review them. We'll break it down. We'll give you an understanding. So that way you never feel like you don't have the ability to be able to find options and be able to get back to leading the life that you deserve. Thank you so much for your time and have a great, blessed day.